We all want the children we care about to lead happy, carefree lives. Unfortunately, upsetting things do happen to children, and this can include abuse or other traumatic events. In this video, I'll answer some of the questions you might have about trauma in children, including what is trauma, how does trauma affect children, how does trauma affect parents and caregivers, and when and why should I seek professional help for my child? What is a traumatic event? A very basic definition is that a traumatic event is a very scary or even life-threatening experience. It might be something that a child experiences firsthand or something that a child witnesses. It could also be something really horrific that has happened to a loved one, like a parent or caregiver or another family member that the child then hears about. A trauma can be a one-time event, like a car accident, or it could be something that a child experiences repeatedly, like witnessing violence in the home or being sexually abused. So here are some examples of events that have the potential to be traumatic for a child. The list isn't exhaustive, but hopefully it will give you a sense of the wide range of experiences that can be traumatic. Abuse is probably the most common trauma experienced by children, and abuse could include sexual abuse, whether it's by a family member, an acquaintance, or a stranger, physical abuse and emotional abuse, and serious neglect could also be traumatic. Witnessing violence in the home or also in the community. So seeing a parent or another loved one be threatened or seriously injured can be very traumatic for a child. Accidents, like being in or witnessing a serious car accident. Being the victim of a crime, like a robbery or an assault. Serious bullying can also be traumatic. Serious or invasive medical procedures, such as surgeries or hospitalizations. A natural disaster, like a tornado or a flood. And finally, the traumatic loss of a family member, a friend, or a schoolmate could be traumatic. So the impact on a child varies greatly, and it's going to depend on a number of different factors. Many children are really resilient and they seem to bounce right back after a trauma. But other children obviously struggle in a lot of ways. Sometimes the changes in a child's mood or behavior are really easy to connect to the trauma, but sometimes not. So oftentimes it's looking back and realizing that those changes occurred after a really stressful or scary experience that tells us that these two things are related. So some young children might become clingy. They might start to have toileting accidents. They might be afraid to go to bed by themselves at night. A teenager might start acting out and engaging in risk-taking behaviors, or they might start blowing off school. So the way that the effects manifest might vary depending on the age of the child. Some children show signs of post-traumatic stress disorder, like nightmares or becoming really irritable, avoiding thinking or talking about the trauma, or they might have difficulty concentrating. Other children show signs of depression, anxiety, or behavior problems, any of which tell us that the trauma has disrupted their well-being. And any of these problems or symptoms would suggest that a child needs help. If the trauma is causing emotional difficulties for the child and it's left untreated, it can have lifelong impact on the child's emotional and even their physical health. And this is what makes treatment all the more important. When a child goes through a trauma, it also almost always impacts caregivers and other family members. Parents often experience their own distress about what's happened to their child, and that can get in the way of providing their child with the support that they need. Parents might feel anxious or depressed. Depending on the situation, there might be feelings of shame or guilt. All of these are really common. And oftentimes parents just aren't sure what to say or how to make things better. So therapy can be a wonderful resource for helping parents and caregivers deal with their own thoughts and feelings about what has happened, as well as figure out how to help their child. Why is it important to get treatment for problems related to childhood trauma? Well, when a child has a physical injury, so let's say a broken arm, we all recognize how important it is to treat that injury right away. Setting a broken arm might be painful in the short run, but it's going to allow the bones to heal so that the child can get back to being a kid and doing what kids do. And we all know that ignoring a broken arm would cause a lot of pain in the long run. And so the same is true when a child has experienced trauma or abuse. We can't undo what has happened, but therapy can help a child and family work through it. It can loosen the hold that the trauma has and minimize the negative effects. Therapy can help kids get back to being kids, as well as help their parents to feel better. So fortunately, just like doctors know what to do about a broken arm, therapists have developed interventions that work for problems related to childhood trauma. We hope you'll watch our next video to learn more about treatment options. You can also learn more about traumatic stress in children by visiting the National Child Traumatic Stress Network website and clicking the link for parents and caregivers.